For generations, the responsibility of family planning has disproportionately fallen on women. They have borne the brunt of managing contraception, often juggling multiple methods to find what works best for them. From birth control pills to IUDs, the options, while varied, come with their own sets of challenges and side effects. The landscape of contraception has long been skewed, with limited options for men seeking to actively participate in reproductive choices. Historically, men have had fewer choices, often limited to condoms or more permanent solutions like vasectomies. This imbalance has left many men feeling sidelined in the conversation about family planning. Condoms, while readily available, can be perceived as interrupting intimacy. They require careful timing and can sometimes diminish the spontaneity of the moment. Despite their effectiveness, many couples find them less than ideal for long-term use. Vasectomies, while effective, are often viewed as permanent. The procedure, though relatively simple, carries a psychological weight for many men, who may be hesitant to commit to such a definitive solution. The fear of irreversibility can be a significant deterrent. This disparity underscores the urgent need for a safe, reliable, and reversible male contraceptive. Researchers have been tirelessly working to bridge this gap, exploring various avenues to provide men with more control over their reproductive health. A groundbreaking development, the hormone-free pill, YCT 529, promises to usher in a new era of reproductive autonomy for men. Unlike traditional hormonal methods, this pill works without altering the body's natural hormone levels, reducing the risk of side effects. This potential game-changer could revolutionize family planning by offering men an unprecedented level of control over their fertility. With YCT 529, men can take an active role in contraception, sharing the responsibility more equally with their partners. Imagine a world where both partners have equally accessible and effective contraceptive options. This balance could lead to more open and honest conversations about family planning, fostering stronger relationships built on mutual understanding and shared responsibility. This is the future that YCT 529 promises to unlock. A future where men and women can equally share the joys and responsibilities of family planning, paving the way for healthier, happier relationships and a more balanced approach to reproductive health. The current landscape of male contraception presents a stark contrast to the diverse range of choices available to women. Women have numerous options, from daily pills to long-term solutions like IUDs and patches, each catering to different needs and lifestyles. Condoms, while effective in preventing sexually transmitted infections, rely on consistent and correct usage, which can be challenging in the heat of the moment. They are a barrier method that requires planning and can sometimes interrupt the spontaneity of intimacy, making them less appealing for some couples. Vasectomies offer a more permanent solution, but require a surgical procedure and often carry the weight of irreversibility. This can be a daunting decision for many men, especially those who might want to retain the option of fathering children in the future. The procedure, while generally safe, involves a recovery period and potential complications. These limitations highlight the need for a male contraceptive that ticks all the boxes: effectiveness, ease of use, reversibility, and minimal side effects. The ideal solution would be one that men can use without the need for surgical intervention or the meticulous attention required by barrier methods. YCT 529 emerges as a beacon of hope, addressing a long-standing gap in reproductive health care for men. This innovative pill promises to offer a reliable, non-invasive, and reversible method of contraception, potentially revolutionizing the way men approach family planning. With ongoing research and development, YCT 529 could soon provide men with a much-needed alternative, empowering them to take more control over their reproductive health and share the responsibility of contraception more equally with their partners. Unlike traditional hormonal contraceptives that target testosterone production, YCT 529 takes a novel approach. It zeroes in on a protein called retinoic acid receptor, or RAR, which plays a crucial role in sperm development. By blocking vitamin A from binding to RAR within the testes, YCT 529 effectively disrupts sperm production, rendering them incapable of fertilization. This unique mechanism holds immense promise for a safe and effective male contraceptive. It offers a targeted approach that bypasses the hormonal fluctuations often associated with female birth control methods. Vitamin A, while essential for many bodily functions, plays a particularly critical role in sperm development. Within the testes, vitamin A is converted into retinoic acid, which binds to RAR, triggering a cascade of events that lead to healthy sperm production. YCT 529 disrupts this process by blocking the binding of retinoic acid to RAR. This effectively halts sperm production at a crucial stage, without affecting testosterone levels or other hormonal balances. Section 5. Promising results in animal studies. The journey of YCT 529 from the laboratory to potential widespread use has been marked by rigorous scientific testing. In preclinical trials involving mice, the compound demonstrated remarkable effectiveness, achieving a 99% success rate in preventing pregnancy. These promising results were further corroborated in studies with cynomolgus monkeys, a primate species physiologically similar to humans. The consistency of these findings across different species provided compelling evidence for the efficacy and safety of YCT 529, paving the way for human trials. Section 6. A glimpse into human trials. This section delves into the critical phase where scientific theory meets human reality. It's a pivotal moment in the journey of any new drug. Building on the success of animal studies, the first phase of human trials for YCT 529 has been completed, and the results are highly encouraging. These trials mark a significant milestone, transitioning from controlled laboratory environments to real-world human applications. The trials, involving a small group of healthy men, focused primarily on assessing the safety and tolerability of the drug. This initial phase is crucial as it helps determine whether the drug can be safely administered to humans without causing adverse effects. The findings indicate that YCT 529 is well tolerated, with minimal side effects reported. Participants were closely monitored, and their health metrics were meticulously recorded to ensure comprehensive data collection. While larger-scale trials are needed to confirm its long-term safety and effectiveness, these initial results offer a glimpse into the transformative potential of YCT 529. The positive outcomes from this phase provide a strong foundation for future research, bringing hope to many who may benefit from this groundbreaking treatment. The journey is far from over, but each step forward brings us closer to a new era in medical science. Section 7. Benefits beyond effectiveness. The potential benefits of YCT 529 extend far beyond its remarkable effectiveness in preventing pregnancy. Unlike some hormonal contraceptives, YCT 529 does not interfere with testosterone production. This means that men using YCT 529 can expect to maintain their libido and other testosterone-dependent characteristics. Furthermore, the reversibility of YCT 529 is a significant advantage. Once men stop taking the pill, their sperm production returns to normal levels, allowing them to regain their fertility. Section 8. The future of male contraception. The development of YCT 529 represents a pivotal moment in the quest for a reliable, reversible, and easily accessible male contraceptive. While further research and larger-scale trials are necessary to fully understand its long-term effects and efficacy, the early results are incredibly promising. If YCT 529 continues to demonstrate its safety and effectiveness in ongoing trials, it has the potential to revolutionize family planning and empower men to take a more active role in reproductive decisions. Section 9. Empowering men, empowering families. The implications of a successful male contraceptive like YCT 529 reach far beyond individual choices. It has the potential to reshape the dynamics of family planning, fostering greater equity and shared responsibility between partners. Imagine a world where men and women have an equal stake in reproductive decisions. This shift could lead to more open dialogues about family planning, reduce the pressure on women as the sole contraceptive decision makers, and ultimately empower couples to make informed choices that align